Hello, I am here at the Arlington Police Station, ready to talk to our Police Chief, Frederick Ryan. We always enjoy talking to Chief Ryan, but we've got a particularly good reason today, and that is that he recently was invited to participate in a panel discussion in the U.S. Senate. The Senate Subcommittee on Homeland Security and Government Affairs had him as one of 4 panelists to talk about, in this particular case, the opioid addiction, the approach to opioid addiction here in our community. I assume as a model for other communities potentially to follow, but we'll find out more. Chief Ryan, as always, a pleasure to talk to you.
Thank you for having me.
Thanks for taking the time. So, first of all, you know, very few people have an opportunity to have the kind of experience you just did. So before we get into the nitty-gritty of what you were there for and talk a little bit about that, both perhaps nationally and certainly locally, just tell us a little bit about how it was for you.
Sure, yeah. It was an interesting and intimidating experience. Had never been a witness before a congressional committee before, so it was a learning experience for me, and there was a lot of lead work leading up to it. The chairman of the Homeland Security Committee had his staff reach out to me. They did a Skype interview with me, and the legal department, the Senate Counsel office, then vetted me. And then after that vetting process, I received the formal invitation from Senator Johnson, the chair of the Homeland Security Committee. Mm-hmm. It was really an interesting process.
And was there, basically, was there any pomp and circumstance to what happened? Is that normal, or are you basically, you show up at a particular time in a particular location, you walk into the chamber and things begin? Yeah,
you show up at the Senate office building, and given the fact that I was in uniform, they had some security protocols for me. And then, you meet with the senator's staff and sort of discuss the hearing and what's expected of you as a witness. And also, you have to submit written testimony in advance. So there's the written testimony, which all the senators on the committee have the opportunity to read and be briefed on prior to the hearing. And then you offer your formal testimony, and following which there was a question and answer with the senators.
Mm-hmm. And I know that you were one of 4 panelists or 4 witnesses asked to appear on that day, and the only chief of police among them.
Correct.
Did you get a sense at any point in the process about why it was that it was you and not another chief of police?
Yeah, I spoke with the chairman's staff, and this committee has been looking at this issue for some time now, and they'd heard and read about what we're doing, and early on the data is trending that we are having an impact on the number of fatalities in our jurisdiction. And that they were really interested in that a law enforcement agency had shifted its philosophical approach to the addiction crisis from all enforcement to treatment and prevention. And so this sort of spectrum, and clearly we've really redirected a lot of our resources on the demand side of this equation, and they really wanted to hear about that.
I wondered if you could just briefly explain, if it's possible to do so briefly, what were the perspectives of the other panelists who were also invited?
Yeah, there was 3 other witnesses, only one of whom took the different approach, in that he felt that the resources and the effort should be focused on the supply side.
So in other words, doing the best to cut the supply.
Cut the supply, arrest and incarcerate violators.
So one might say a traditional approach.
Right. Mm-hmm. And he had worked in a prior presidential administration for the Office of National Drug Control Policy. And then there was a gentleman from New York City who runs the Drug Policy Alliance who argued very passionately that the war on drugs has been lost, and that this really has got to be a public health approach rather than a law enforcement approach. And then there was the 4th gentleman was from Canada, and he talked about some of the harm reduction that they're doing up there, where they have some safe use locations where people can use in a safe environment to try to drive down HIV and hepatitis and the other issues associated, the public health issues associated with this epidemic.
I was struck. You mentioned that one of the other witnesses was talking about what a failure the war on drugs has been, and I was struck in preparing for this interview in seeing that I think the senator who leads the committee shared that $1 trillion, I believe was the figure, has been spent on the war on drugs in just the last 4 years.
Right.
That is an astonishing, astonishingly eye-opening figure, considering that we as citizens don't necessarily see any changes, certainly between 2012 and 2016, and further back from that.
Right.
So clearly a need for new approaches here.
Right, and I don't know if you heard my follow-up. I said, having spent that $1 trillion or more, we can't keep drugs out of our prisons, much less the streets of America, from a heavily focused supply-side policy. We've got to, there's a spectrum, right? And it's about proportion, and we've got to shift some of those dollars being spent on addressing the supply and push it over to the demand side. And in fact, I had a call just on Friday from the White House Office of National Drug Control Policy. I've been invited down next week, one of 20 police chiefs, to stand in the White House to support the President's $1.2 billion on treatment and prevention of the drug epidemic. So, our voices are being heard at the highest levels of government in America. We're changing the conversation. We got to stop criminalizing addiction. It is what it is. It's a public health challenge. It's a disease, and we've seen it right here in Arlington, where we arrest somebody suffering from addiction, we bring them to court, they're back on the street 4 hours later, doing the same thing they were before we arrested them. No change. And that revolving door at the courthouse is not good policy. And I've also been asked, well, there's drug courts and there's these other alternatives in the criminal justice system. Once you put somebody suffering from a substance disorder into the criminal justice system, you're adding a whole series of complex governmental steps that somebody who's already in crisis now is in this complex criminal justice system, and you can't reverse that. And we've found that diverting pre-arrest into treatment and developing a treatment intervention plan with each individual has had a positive impact.
Yeah, and I think what you're describing is the program that you were down there to talk about,
right.
Which is PAARI. Do you have an acronym? Is it PARI?
It's
is
PARI.
referred to as PARI?
Yeah.
And that is Police Assisted Addiction and Recovery Initiative, if I've got that right.
Yes, sir.
So just go ahead and explain a little bit more what the different components or elements of that
right.
approach
right.
are.
So PARI supports law enforcement agencies in pre-arrest diversion programs with cases related to addiction. And there are really two key models. There's the Gloucester model and the Arlington model. In Gloucester, they invite folks in and connect them with an angel, what's called the angel program. And the angel will then help.
I'm sorry, just to clarify, you say they invite folks in as in addicts, self-identified addicts,
correct.
Basically?
Yeah.
Okay.
So anybody suffering from substance disorder can present at the police station, and the police will facilitate that person through the treatment process. And we've learned that too, that just the treatment process is incredibly complex, and healthcare insurance, and so you've got somebody in crisis with a substance disorder, and we've got all these complex systems in place that inhibit success. Mm-hmm. So we've tried to stand up programs like the one in Gloucester, which is sort of an intake, and in Arlington, we do it the other way around. We do outreach with our in-house social worker. And develop an intervention plan to help people who are suffering from substance disorders navigate their way into treatment. And as part of that, and I think this is incredibly important, James, it was two issues, the stigma associated with addiction, but also the stigma associated with relapse. We plan for relapse. Relapse is a part of recovery. And so we help families sort of manage the fact that their loved one is highly likely to relapse, and that's, needs to be a part of the plan. But to keep the long-term goal, keep focused on the long-term goal of long-term recovery. And I mentioned stigma. That's a huge, particularly in a bedroom suburb like Arlington, where people are just ashamed to admit that they've got a loved one who's suffering from a substance disorder. And when I go out and give speeches, I'll rather than ask people in the room who has been impacted by addiction, either directly or indirectly, I'll ask people who hasn't been impacted. And very few hands are raised in the room. So we've got to, as a community, we've got to create a trusting environment and a supportive environment for people who have a family member who's suffering, so that the village can support that person and their loved ones in the recovery process. And I think that's incredibly important that people, you see, because detox occurs in a private setting, oftentimes a healthcare setting. Long-term recovery occurs in the community. And we as a community need to embrace people who are trying to stay in long-term recovery. And we try to really get that message out in the community.
I have to admit that I've had the privilege of talking to you on a number of occasions in the past, and I'm familiar with your work and your record here in Arlington. And still, to hear somebody in uniform and knowing that you are the chief of police speaking in that way about this scourge, basically this epidemic that we're having to confront, and speaking about not just thinking through, not judging at the initial stage, but again, as you say, planning for relapse, understanding the long-term kind of the various bumps along the way and planning for those. Again, emanating from a local law enforcement authority, it's extremely unusual for me even to hear that, and like I said, I'm familiar with it. So I can only describe it as it seems revolutionary in some ways. Perhaps that's too strong a term, I'm not sure. I'm wondering for you let's call it an innovative thinking. Where are the main challenges for you that you have identified for yourself operating within a town, for Middlesex County as a county, for instance, for at the state level and then at the national level? Where are the impediments, the big challenges to spreading the word or to encouraging others to adopt this innovative approach?
Right. Yeah, the big challenges are really macro level. Changing policy not only in the Commonwealth but nationally, and we're happy and proud to be a part of that conversation. We're speaking with legislators and policymakers all over America, but the challenge is that spectrum that I spoke of earlier, and shifting resources from supply side policy to demand side policy, so that long term we can be looking back at this when we're in our rocking chairs and reflecting back on our careers, so that this is almost like tobacco smoking. We've made great strides
right.
at reducing the use of tobacco. Hopefully we can have that same success with drugs in America, and rather than giving people scarlet letters and incarcerating them and shaming them, that we flip that on its head and really support people into long-term recovery.
So just briefly, just to bring it right back to Arlington before we close, how long has this policy been in place, and what results have you been seeing?
Thank you, great question. So in calendar 14 and early calendar 15, we were experiencing a lot of fatal overdoses, about one a month on average, along with many other non-fatal overdoses and reversals. And I should point out, our firefighters and our police officers, it's commonplace now for them to go out and administer nasal naloxone and save a life. And I never thought that life-saving measures would be a weekly occurrence, but it really is, and sometimes more frequently than that. Sometimes some weekends we have 2 and 3. But as we saw those fatal overdoses, we knew we had to reverse those trends. And so we rolled out our program July 1 of 2015, and we went nearly 8 months following the implementation of our program with only one fatal overdose. And so we're coming up on a year. We're going to sit down and reevaluate our data, but there's no question that we're having fewer fatal overdoses in Arlington, and there's no question that our program is a part of driving down that trend. We're not fully responsible for it. And we have a number of community meetings where a lot of folks have come out. Some folks have come out who don't have a family member suffering, but they're just there to support others. You know, I talked about that supporting community. And so we're getting, listen, there's no better community than Arlington to engage in community policing activities and the philosophy of community policing. We've got an engaged community. And we heard loud and clear from our community that they don't want criminalizing of addiction, and they want a more empathetic approach to policing. We're very well connected with our public health folks, Christine Bongiorno and Jim Feeney over at our health department. And it's a team. And you know, we're very proud of the fact that we've driven down deaths in our community. We're going to continue to do so, but there's a lot of work to be done. And you know, we're dealing with the proximate cause of the problem now. We're driving down deaths. We want to move into the root cause of the problem, and helping people address opiate addiction and get into long-term recovery.
But of course, I mean, just to summarize or to confirm, you are seeing the results of this approach, and those results are, you know, they're quantifiable in terms of, as you said, the number of deaths is decreasing in a notable way.
Absolutely.
Yeah, and I assume, of course, that that's why you were invited to the Capitol, and now I guess the White House also wants to get in on the action. You're going to be, you're going to wear out a rutted path between here and Washington if you're not careful.
Yeah. Well, next week's event is tentative. I have a scheduling conflict, but we'll see if we can work that out.
All right. Well, we will. Perhaps we'll have another conversation after that about differences between Capitol and White House protocol.
There you go. Right.
I look forward to that.
Right. Thank you, James.
Yes. So from Arlington's police station, after another informative conversation with our chief, Frederick Ryan, this is James Milan for Arlington Public News and for ACMi. Thanks for joining us.